Welcome to Pediatrics and Neonatology. This video is about childhood obesity. First is the simple obesity. It is due to increased caloric intake, decreased activity, and some genetic factors. Other is the pathological obesity, which is due to endocrine disorders or some syndromes. Endocrine disorders include Cushing's syndrome, hypothyroidism, growth hormone deficiency, hypopituitarism, and pseudo-hypoparathyroidism. Genetic syndromes which are associated with obesity include L-Strom syndrome, Bardet-Biedl syndrome, Beaumont syndrome, Carpenter syndrome, Prader-Willi syndrome, and Down syndrome. Now some important definitions related to obesity. First is BMI. It is body mass index. It is a measure of obesity in children and it is calculated as weight in kilogram divided by height in meter square. BMI is routinely plotted on age and gender appropriate charts. Now the annual increase more than 2 kg per meter square is an indicator of rapid increase in the body fat. Now if BMI for age and sex is between 85th and 95th percentile, then it is considered as overweight. Obesity is defined when BMI is at or above 95th percentile for age and sex. And severe obesity is BMI for age and sex at or above 99th percentile. Now children who are less than 2 years of age, weight for length more than 95th percentile are considered as overweight. Now the physical finding in the evaluation of childhood obesity. These include anthropometric measurements including weight, height, occipitofrontal circumference, upper segment to lower segment ratio, and BMI. Now if obesity is associated with normal or increased height, it means it is simple obesity. While if obesity is associated with short stature, then this is usually pathological obesity. Now in vitals, if there is bradycardia, it points toward hypothyroidism, while hypertension is present in complicated obesity or Cushing's syndrome. Now on journal look, moon face plethora acne or hirsutism is a feature of Cushing's syndrome. Acne and hirsutism in girls is associated with polycystic ovarian syndrome. Coarse faces is a feature of hypothyroidism, while round premature face is present in growth hormone deficiency. Cleft lip and palate are present in hypopituitarism. Large tongue is associated with Down syndrome and hypothyroidism. Now it is also important to see the distribution of body fat, whether it is truncal or generalized, because truncal obesity is usually pathological. Then obesity is associated with different types of syndromes, so any dysmorphism should be noted. Next, mental state is normal in simple obesity, while there may be mental retardation in Prader-Willi, Bardet-Biedl, Carpenter, L-Strom, Down syndrome, untreated hypothyroidism, and pseudo-hypoparathyroidism. Now, voice is deep and hoarse in hypothyroidism, and there is hearing and vision loss in L-Strom syndrome. Vision is also impaired in Bardet-Biedl syndrome and pseudotumor cerebri, and visual field defects may be present in some pituitary tumors. Now in hands and feet, polydactyly and syndactyly points toward Bardet-Biedl syndrome and Carpenter syndrome. Simian crease and saddle sign is a feature of Down syndrome. Short fifth metacarpal producing a dimple on the dorsum of the hand is a feature of pseudo-hypoparathyroidism. Skin examination is also important because striae points towards Cushing's syndrome. Mixed edema is a feature of hypothyroidism. Now in severe obesity, a thick, dark, raised, rough rash is present on the neck, and this is called acanthosis nigricans. Goiter is a feature of hypothyroidism. Now chest and cardiac examination is important to note any complication. Abdominal examination may reveal hepatomegaly in severe obesity. Now there is adrenal mass in Cushing's syndrome or pelvic mass in polycystic ovarian syndrome. Hypogonadism is a feature of Prader-Willi syndrome and Bardet-Biedl syndrome. Tenor staging is advanced in Cushing's syndrome, and gait should also be noted because it may be limp in case of slipped capital femoral epiphyses or blount disease. There may be proximal myopathy in case of Cushing syndrome. Now, the investigations which should be done in a case of childhood obesity. Now, these include lipid profile, serum cholesterol and serum triglycerides level, low density lipoprotein, very low density lipoprotein, and high density lipoprotein. Abdominal ultrasound should be done. It may reveal fatty change in the liver or gallstones. Chest X-ray is important, and X-ray for osteoporosis and bone age should also be done. Other tests include blood sugar random, oral glucose tolerance test, and liver function test. Now, if Cushing syndrome is suspected, then relevant tests such as serum cortisol diurnal levels and all other tests should be done. Serum T4 and TSH levels are done in case of hypothyroidism. Insulin stress test, IGF-1, and growth hormone binding protein levels are done to diagnose growth hormone deficiency. And in addition, all baseline urine and blood tests should also be done. Now, the risk factors for childhood obesity. Family history is important. If one parent is obese, then risk is 3%. If both parents are obese, then risk is 10%. Other risk factors include consumption of sugar, sweetened beverages, lack of family meals, large portion size, food prepared outside the home, television viewing, video game, poor sleep, and lack of activity. Now, the complications of childhood obesity. There are two important pulmonary complications. First is obstructive sleep apnea. 13 to 33% of the obese youth develop this problem, and it presents as snoring, apnea, poor sleep, and nocturnal enuresis. There may be morning headaches, fatigue, and poor school performance. Second complication is obesity hypoventilation syndrome. There is severe obesity and restrictive lung disease. It may lead to right heart failure. There is dyspnea, edema, and somnolence. Next is cardiovascular complication in obesity. This is hypertension, and it is defined as systolic blood pressure on 3 occasions is more than 95th percentile for age, gender, and height. Now, other cardiovascular complications in obesity include lipid abnormalities. These include high density lipoprotein less than 40 mg per deciliter, total cholesterol 170 to 199 mg per deciliter is borderline, and more than 200 is high. Low density lipoprotein 110 to 129 mg per deciliter is borderline, while more than 130 is high. And serum triglycerides more than 150 mg per deciliter are present in obesity. Now, if triglycerides level are more than 400 mg per deciliter and there is nausea, vomiting, and abdominal pain, then also assess for pancreatitis. Now, next is gastrointestinal complications in obesity. These include non-alcoholic fatty liver disease. 10 to 25% of obese youth have this problem, and it is commonly asymptomatic, but there may be hepatomegaly, recurrent weak abdominal pain, and dependent edema. Alanine aminotransferase level is usually elevated, but it is important to rule out other liver diseases. This non-alcoholic fatty liver disease may progress to fibrosis and cirrhosis. Other gastrointestinal complications include gastroesophageal reflux disease due to increased abdominal pressure, and it presents as abdominal pain or heartburn. Next is gallstones. It is associated with rapid weight loss. There may be right upper or epigastric pain, vomiting, or jaundice. Ultrasound should be done in order to diagnose it. Then there may be constipation. It is associated with inactivity. It may present as abdominal pain, distension, and hard, infrequent stools. There may be fecal swelling or incontinence. Now, the endocrine complications of obesity. There may be impaired glucose metabolism, and this present as elevated fasting glucose 100 to 125 mg per deciliter, or impaired glucose tolerance test 2-hour OGTT is 140 to 199 mg per deciliter. Or there may be type 2 diabetes which present as polyuria and polydipsia, unintentional weight loss, or random glucose more than 200 mg per deciliter with symptoms. In this case, fasting glucose is more than 126 mg per deciliter, 2-hour OGTT is more than 200 mg per deciliter, and glycosylated hemoglobin A1 is more than 6.5. Now, some other endocrine complications, these are polycystic ovarian syndrome and metabolic syndrome. Polycystic ovarian syndrome is diagnosed if two of the three features are present. First is hyperandrogenism, which presents as hirsutism or acne. Second is irregular menses, and third polycystic ovaries due to insulin resistance. There is risk of infertility and endometrial cancer in this syndrome. Pelvic ultrasound-free testosterone, luteinizing hormone, and follicle stimulating hormones level should be done. Now next is metabolic syndrome. It is characterized by central obesity, insulin resistance, dyslipidemia, hypertension, and glucose intolerance. Another complication is hypothyroidism. It may be asymptomatic until uncompensated. There is linear growth failure, cold intolerance, decline in school performance, coarse features, and thin hair. Now, an important neurological complication is pseudotumor cerebri. This presents as headaches which are severe and recurrent and are often worse in early morning. There may be papilledema on examination, and on lumbar puncture, CSF opening pressure is increased. Pseudotumor cerebri may lead to vision loss, so neurological and ophthalmological consultation is important. Next is orthopedic problems. First is blount disease, and it is due to stress injury to the medial tibial growth plate, and it presents as bowed legs and limp. It is often painless, but knee pain may be present. It is diagnosed on the basis of knee X-ray. Another obesity complication is slipped capital femoral epiphyses. It presents as hip, groin, or knee pain and decreased mobility of the hip joint. There is limp and the leg is held in external rotation. Hip X-rays are required. Now there may be musculoskeletal problems in obesity. These include back pain, joint pains, and frequent strains or sprains. Dermatological complications are also common. And first is acanthosis nigricans. It is due to secondary effect of elevated insulin, and there is darkening of the skin on the neck, axillae, and groin. Now other complications include intertricho, frunculosis, or paniculitis. There may be rash, pannus, or inflammatory papules. Other complications of obesity include depression and anxiety, eating disorders, and childhood abuse. Now the management of childhood obesity. First, confirm the diagnosis. Do the counseling of the parents, and if any specific cause is identified, then treat it. Now for simple obesity, multidisciplinary approach is required. These include lifestyle modification, cognitive behavior therapy, nutritional advice such as fruits, vegetables, whole grains, lean meat, fish, and poultry should be added in diet, while high calorie food including chocolate should be avoided. Now, gradual approach is recommended. Advise parent that child should not skip meals and he should avoid beverages and snacks. Now, advise parents to fix a place and time for eating. Use small plates on the table and do not force the child to clean plate. There should be no TV watching during eating, and all family should eat the same food. Now, food should not be used as a reward and promote breastfeeding. Weaning foods should include fruits and vegetables, and traffic light diet plan should be used. Now, exercise is an important part of obesity treatment, and it should be for 60 minutes daily for 5 days per week, and all family should engage in physical activities. Now, child less than 2 years of age should not watch TV, while for children more than 2 years of age, screen times should be less than 2 hours per day. Now, only one medicine is approved for children more than 12 years of age, and this is lipase inhibitor or Listat. Next is the surgical treatment for obesity. It is the bariatric surgery. It is only recommended when there is complete or near complete skeletal maturation, BMI is more than 40, obesity is associated with complications, and in children who have failed 6 months of a multidisciplinary weight management program. For this, Roux-en-Y procedure or adjustable gastric band surgery is done. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more videos.